Welcome to the Table Network podcast, episode number 2. Excited to have Monica today from Impact Family Wellness. Thank you for joining us. Now, I'm coming into this blind. You guys did the last Table Network. I wasn't even there. And so I have no idea what I'm getting into, but I'm very, very excited. I want to start us with a question that comes from our last and first podcast guest, the friendship guy, David Cherry. Why do you think people struggle with friendship today?
Oh, friendship is hard, especially as an adult, because it takes effort. It takes a decent amount of effort on two sides. And also, I think you have to find the people that are in the same part of their life as you, right?
Yeah.
Like, I am at the point where I have a 10-year-old. And so he's pretty hands off. Like, I can leave him at home for a couple of hours. Don't tell the police. But where you struggle is when you try to make friends with somebody who has a newborn at the same time, right? Because they're in a completely different season of life that I don't want to play in. I'll make you dinner, but I don't want to be there, right? And they're just exhausted and different in a different world, right? Versus the like retired person or the guy just out of college looking for their world. So I think not only is it hard to find people, especially outside of a workspace, because we're not like, at least I'm not going to clubs anymore. Like, I go to book club, that counts, right? And so I think it just takes a lot of effort and also finding the right person in the right season of life. It's much like finding a mate, right? Like a significant other, where you might find like the best significant other ever, but if they aren't at the right time in their life where they're looking for the same thing you are, they want the same things, they might want that in 3 years, but you want it now, then it just doesn't work. And it's not that either of you are bad people. It just has to go with where it is. So my long-winded answer to your question is, it's because it's hard.
Yeah. I mean, life is hard. So many things are hard. We're so complicated. And even just hearing you say that, thinking about all the things that have to align to have a good, healthy relationship.
Mhm.
Now throw a business on top of that.
Right.
Throw kids on top of that.
Yeah.
Right.
So,
It's a
all
lot.
right, let's dive in.
Yeah, man, we could have totally turned this podcast episode based on what you just said there. I'm like, yes, facts. The dating part speaking to my soul right now. So yes, like it is very factual, but yes. So Zac, I hope you have so much FOMO because we did have a blast this last one and some epic conversation. But for those who maybe didn't get a chance to attend, like Zac, probably would be important for everybody to hear who Monica is, and you can tell us a little bit about Impact Family Wellness. But when you do this, I would like to hear kind of what also inspired you to launch Impact Family Wellness. So kind of explain, and this is also side note, I'm going to be over here just like hyping up Monica like nobody's business because I think she's one of the coolest cats on the planet. But just what she does and how she does it is incredible. So very much explaining what makes you so different compared to everything else in the medical space, but then what inspired you to start this too?
Sure. Well, that was a great intro there. I like it. I like my hype spot. So yeah, I am a family nurse practitioner and I have been for 17 years. And I went to school to take care of human beings. I really enjoy relationships and I really enjoy watching people have their best lives, and that includes their health. And so I went into the healthcare world expecting to be able to take care of people, and turns out that wasn't what I was doing at all. I was doing paperwork and I was treating my patients like cattle because I had to see 30 of them every single day, give them some sort of Band-Aid and send them on their way. And it was awful. So I was relocating to Texas a few years ago, and I actually got a Facebook ad that said primary care physician takes home $400,000 a year and is home in time for dinner. And my friends, that clickbait worked like a charm. I was like, that's a lie. I want to know about this. So it was all about this model of healthcare called direct primary care, which is what Impact Family Wellness is. We are a membership-based primary care office. So we don't take insurance, but we take patients with or without insurance. We work off of a monthly fee that's less than $100 a month, and you get unlimited access to the office. No copays, no extra fees, includes telehealth. You can text your provider directly and they'll respond to you within 2 hours. not 3 days, 2 hours. And so we just try to make healthcare easy, right? We have same day appointments. You know who you're going to see. You have a trusting relationship with them. We have discounts at labs and all sorts of things so that we're all about price transparency. And so I jumped into this world because I was exhausted, honestly. And I've always loved primary care, but it's so hard because you spend so much of your day doing paperwork. And there's so much more to health than just pushing drugs on people. And I didn't want to keep doing that. And so I clicked on the clickbait and learned about this model and went to my husband and said, I'm going to open a practice where I can take care of less patients, take better care of them, have more control of my time, and make the same amount of money. And my MBA holding husband laughed in my face. He was like, that sounds great, Monica, but that's not real life. You can't do that. So needless to say, I Googled how to write a business plan because AI wasn't a thing back then. Convinced my husband it was a good idea, moved to Texas, didn't know, I knew 2 people in all of Central Texas when I moved here 6.5 years ago. 3 weeks later, opened my practice, and here we are. It's all history from there. So we've slowly grown from giving myself a job to actually having a very successful business. We have 3 clinic locations and I have 10 full-time employees. So yeah, we're doing it, but ultimately we're taking care of human beings. You know, like we listen to them, we actually take care of the things that matter to them. And, you know, we deal with their insurance company when we have to.
That's awesome. Is your husband a believer now?
Oh yeah, he has to be. You know, in the beginning, he helped me a lot because he does have a business background and I don't. I have 3 degrees in nursing, not one in business, accounting, marketing, any of it. I had no idea what I was doing. Let's be real honest there. And so in the beginning, he helped me a lot with like, how do I do this? What do I do with this? Like, how do you find a domain name? Who knew? But now he's 100% believer. And mainly that's because he sees the difference in me from when I came home in the insurance world, just exhausted and like overwhelmed, to coming home, being home in time for dinner, not having to bring charting home with me, and actually doing what I love.
Awesome. I mean, so many of us are in that same position. Like we want to care for people. We have a passion for blank. We might not know how to do everything around it. What role does health play in us on our leadership journey?
Oh, well, I mean, if you don't have it, you're going nowhere, my friend. Because if you feel terrible, I don't care how great of a leader you are, you're going to suck at it because you feel awful. And so I really sit on 4 pillars of health. Are you ready for them? Here they come. Write this down. Nutrition. You put crap in, you're going to get crap out. You need to fuel your body with decent food, not ultra processed disasters. 2, body movement. Notice I did not say exercise. I said body movement. You don't have to sweat. You just need to move. Touching your toes actually counts. Number 3 is sleep. If you think that you can live off of 4 hours of sleep, you're just lying to yourself. You can't. I don't care who you are. You will eventually not make it. So 7 to 9 hours every night of like real sleep, not 7 hours in the bed, like eyes closed, phone off, sleeping. 7 hours minimum. And the 4th is the biggest one, and that is stress. More than 80% of our healthcare issues in this country are caused by chronic stress. And so if you cannot deal with your stress, whether that's through exercise or meditation or coaching or mindset changes, all of those things, right? Like life is stressful, right? We all want to build this business. That is stressful, but you've got to figure out how to deal with that. Otherwise, you're just going to be real sick and then you're useless to everybody.
Yeah.
Well, and I think one doesn't happen without the other, right? Like if you aren't moving your body, you are not like releasing endorphins that's going to even put you in a good mood to be able to be in a good headspace. If you're fueling your body with crap, no wonder you feel like crap, which is also going to make you think in a negative headspace. Like if you're not getting sleep, you're going to be a not fun human to be around, which is going to also impact your mindset. So it's like you can't have one without the other.
Absolutely.
Well, and then just a shameless plug. I didn't know about this model. I didn't get the clickbait ad, but some of my stress comes from being a solopreneur and trying to figure out how do I take care of my health? When was my last blood panel? I haven't had a physical since like 7th grade. And I realized I need to do something, but I don't know where to start. And so even hearing this exists, I think is going to give some peace to a lot of people who are trying to figure out where to start this journey.
Yeah. And you're not alone, Zach. We see this all the time. And it's because our healthcare system in the United States is not a healthcare system. It's a sick care system. We
Mhm.
take care of people when they get sick.
Yeah.
Yes, we have a preventative annual exam, but just like you said, nobody says that that's important. And in fact, we think it's really important at our office to the point that your annual physical labs are included in our membership. So there's no extra cost, there's no fee. You just have to go get it done. And it's a pretty extensive panel as well. Like it includes a diabetes screen, a vitamin D screen, because we really want to know, like, you might look great on the outside, but that doesn't tell us anything about what's actually going on.
Yeah.
And so it is really important, and it is really hard, right? Like you call Baylor Scott and White and say, "Hey, I need a physical." And they're like, "Well, we can see you in 3 months." And no, we can't tell you how much that's going to cost. And it's crazy. It's mind-blowing to me that we can't make healthcare easier and more accessible, because the bottom line is, if we made it more accessible so that people could get preventative care and could come when something's a little bit wrong instead of a lot wrong, we would be so much healthier in this country. But unfortunately, we just put it off, and then we get really sick, and then we end up with a heart attack, and we end up in the OR. And that's awful. Where if we had just seen you 2 years, 3 years earlier when you were starting to have the struggle, we could have prevented the whole thing. So,
Hold up. Let me just sign up real quick.
right.
Um,
ImpactFamilyWellness.com.
there we go. I
Yep.
love the approach, like proactive versus reactive, knowing the person and work, like partnering with the person versus treating the symptoms, like just getting people through the door.
Yeah.
I love the personal approach. So a lot of what you do is patient care, but how
Mhm.
does that translate to like taking care of your people? Now you have people underneath you and your business as well.
Yeah, so I actually stepped out of patient care about a year and a half ago. So I still do some things because there's a lot of procedures that I'm the only one that does them. But for the most part, my 7 other nurse practitioners do all of the hands-on patient care, and I do all of the leadership and management. And so most of my day is spent educating people on what direct primary care is, doing marketing stuff. But ultimately, it's the visionary stuff, like, where are we going? What are we doing? How do we make this process easier? Do we need a software to make this easier for people? That's really my job. And also, I sit down with every one of my employees for at least 30 minutes every month to make sure that they are okay. And it's not a like meeting where I say, "Hey, you need to do this, this, and this." It is a meeting for them to say, "Hey, this is what I need, and this is how you can better serve me as the CEO of this company."
Yeah. And that transition, has that been freeing, joyful, or hard to let go of?
I was really concerned about it because I love healthcare, right? And I've done it for so long, and I'm good at it now. But I do like the challenge of running a business. But ultimately, the part of healthcare that I love is relationships.
Mhm.
And I still get to do that every day, right? Like I come to the Table Network, and I'm not just saying this because I'm on this podcast. It is my favorite networking group. And it's because the people there are so genuine. Like nobody shows up at the Table Network and is like, "Here's my card. Here's what I do." They're all like, "So who are you? What do you do?" Like they genuinely want to know who you are. Of course, we're all there to grow our businesses, but I feel like it's more of a relationship place. And that's my MO, man. That's what like really lights my fire, is getting to know people and helping people, because that's what I still do, right? So I meet people and they say, "Oh yeah, I'm struggling with X, Y, and Z." It does nothing better in my life than to be like, "Oh, let me tell you how you fix that problem." Which is why I've gone into the whole book writing and consulting world, is because I love to help people now on a business level, because I've made lots of mistakes that they don't need to do. But it also makes me feel like $1,000,000.
Yeah, I love that. And that's what we see. Like if you just sit down and get to know the person across the table from you, it'll yield returns in ways you couldn't imagine. There's
Mhm.
no strategic plan that can hold it.
Yeah.
Tell me about the book writing and the consulting. Like, where do you see this going?
Yeah. So my initial plan was to open more clinics, right? I was going to have 10 clinics, and it was going to be amazing. I was going to be like the best healthcare system in all of Central Texas. Well, what I quickly realized, that every clinic I open takes more of me, more of my time. And I am not motivated by money. I am motivated by my time. You let me hang out with my family, I'm here for it. And so I realized that opening more clinics was not what I wanted to do, but I still had to figure out how I was going to make an impact in the world. And so I need to make that impact by getting other healthcare providers who were in the same boat I was, love primary care. They're really good at it, but the system's broken, to get them to open their own direct primary care clinic. And so the book I wrote is not a how-to book. It's a should you. Like, are you the right type of provider? Like, you have to be a good provider, not a mediocre one. And you have to have an entrepreneurial spirit, right? You have to be able to market yourself. You have to be able to talk to people. And so the book is a should you. Like, are you the right person for this? And then at the end of that, if you're like, yes, this sounds amazing, then I made an online course that is the how to establish an LLC, how to get that domain name, how to do all of the things to launch. And then I offer consulting from there.
That's cool. Well, looking at the website, I mean, the marketing's on point. Like the stories, I understand what you do. I just assumed you were a marketer who got in the healthcare field.
Oof. No, definitely not. It has been a lot of learning. You should have seen my first website, Zac, and my first logo. But this is what business is all about. Things don't have to be perfect. They just have to be done. And so you have to start somewhere. And if you read the copy on my first website, you would be like, what do you do? Because it was written from a provider's point of view, not the customer. And so there's so many things in business, learning who your ideal customer is, understanding that not everybody is for you and being okay with that. But also making sure that you're telling your story in a way that matters to them, not to you, right? And unfortunately, we have so many different benefits, right? So some people come to us because they just want a same-day appointment. Some people come to us because they just want somebody who can listen. Some come to us because they have no insurance and they need somebody they can at least call, right? And so there's so many different pain points that we fix that it makes marketing difficult because we have to speak to all of those. But you just have to focus and try to get across as much as you can. So I appreciate the compliment, though.
Yeah, I think a lot of people look at like version 10.0 and just assume it was always like that, when really you just learn as you go. All right, I've got one more question, and then Jayme's got a question to wrap up. But for the person that maybe started out wanting to serve people, maybe it was patient care, maybe it was another field, and they're just kind of sitting in the weight of, it's got to be more than this. Like, I signed up because I actually want to help people. What advice would you give that person? I think of my sister, who's one of my closest people on this planet, and she got her RN, and then she popped right in the middle of COVID. And it's a really, really hard field and a hard time with the right heart. But what advice would you give somebody in that type of situation?
Yeah, I think really defining what success means to you, I think is really important, right? And so helping people is such a broad thing, right? You can help people by being their nurse, but you can also help people by being their personal coach. You can also help people by giving them business advice. You can also help people by just talking to them and listening, right? And so really figuring out what lights you up, I think is the most important of how you want to help people, right? I love doing healthcare, but I'll also tell you, I'm over talking about snot. Like, I don't want to talk about it. I've done it for so many years. Like, I don't want it. That doesn't light me up anymore. Being like, well, there's a virus and a bacteria, right? What does light me up is talking to other entrepreneurs about their business journey and seeing if I can help them, right? And so it's really defines on what your idea of helping people is. And that might still be in the nursing world, or she might be able to help women going through menopause, right? It doesn't necessarily mean she has to be at a bedside, right? Like helping mucus-filled COVID patients, because that is horrifically terrible and awful. And so I would say really defining what fills you up, but still meets that world of helping people. Because let's be honest, most people just help people all day long. Like in the general world, like even an accountant, as much as they use numbers, they're helping somebody's business, right? The person that serves your table at a restaurant, they're helping you get food so that you don't have to make it at home, right? So most of the world helps people. It's just a matter of defining what that success is to you.
It's good.
Man, this is so good. I love this. Okay, I kind of want to pivot a little bit, but it's still going to go with this whole helping concept because, like, yes, you are right. In every way, shape, or form, we are making an impact and we're helping people. And actually, side note, I'm going to pin this here quick too. I remember I had a mentor of mine tell me this, and it's always stuck with me that like the most like one of the greatest indicators of a true leader is somebody who is willing to acknowledge when it's time for them to walk away from a leadership position. So like the fact of you recognizing like, hey, I'm really good at this and I've built a successful business and helping people. This no longer is where I shine. And this is where I can hand this off to other people who can help better in this arena than what I can any longer. So I love that. But so tying this now back all in is like, I know that now you're more in the consulting realm of that, but like, and especially through COVID, beautiful example, you know, speaking of that, it's like you help people in such a like high stress situation who are coming in with such negativity. Like, and I know family and like your personal time is important to you, but like, how do you, and how did you ensure that like you were being fed that way you had the energy to not take that home with you and to feel fulfilled by the people you were spending your time with outside of work mode? Am I asking that very clearly? I know I'm all over the place.
Yeah, no, I understand what you're saying. COVID was that was a rough one. I have never had patients as sick as they were during COVID that I legit couldn't really help. Normally it's like, oh, we can try these things. And we like ran out of options quickly. And that was really hard. But I will tell you one thing that I've learned that I think allows me to make sure that my patients don't take everything from me is I set very clear boundaries because, and by the way, I learned this the hard way because I got walked all over for quite some time. Because especially as a new business owner, I was like, yes, I will do anything for you. I have to show you how great I am. And quickly realized that that was not sustainable. And so setting boundaries doesn't make you mean. It doesn't make you a jerk. It actually makes you available for everyone so that one person can't just walk all over you and take everything from you. And so learning to set those boundaries of these are the times I'm available. Don't call me after this time because I'm not going to answer. You have scheduled an appointment for this long with me. And if you show up 10 minutes late, that doesn't mean you get 10 minutes extra at the end, right? So just really putting in place the fact that I also matter and making sure I take care of myself. It's really easy to schedule over your time at the gym or schedule over your date night with your husband because there might be this business opportunity. And we are the worst at doing this, right? So stop it, right? If that was your sister's calendar, would you do that to hers? Probably not. If it was anybody else's calendar, honestly, you wouldn't. And I'm actually listening to the book called Buy Back Your Time right now. And it talks a lot about finding an administrative assistant, which I have a virtual assistant. He's amazing, but I just need to give him more control. Like it talks about giving people full control of your calendar because they won't make excuses, right? They won't be like, oh yeah, she can just ignore that appointment. They will stick to the guidelines without having the personal side of it in it. And so we really need to do that for ourselves, even though it's really hard.
That's good. Is your VA stateside?
No, he's in the Philippines and he's the best thing ever. Shout out to Kent, man. He has been with my company for a year and a half and he is the hardest working, smartest, like best dude ever. He typically gets things done before I even ask. And I'm just mind blown by how good his work ethic is just, he needs to set some boundaries, honestly, because he would do anything for me at any time. But yeah, if you don't have a virtual assistant yet, you probably should because they're very affordable and absolutely life-changing.
Can we use Kent?
No, he's mine. 100% mine. You cannot have him.
I love your adaptability and innovation in a traditional field. I love how you're shaking it up and just seeing the fruit that comes from that. It's encouraging as an entrepreneur. It's encouraging just as a community.
We have to, right? Like this is why our entrepreneurs are born is they see it, something that's broken and they fix it, right? And so that's really what we're doing with healthcare is so far broken. I mean, open enrollment is in just a couple of days when this is being recorded, and people are going to be shocked by the increases in their premiums. And guess what? They're not getting better healthcare. They're not getting anything more for all of that money. So I'm going to tell you, if Netflix raised your cost by 30%, you would think twice about continuing it. Now, I get it. Netflix and medical insurance are not apples to apples, but we really have to think about how our healthcare system is run in this country, because it's going to crumble if we don't do something.
And this might be too big of a question, but I'm curious as to where you see that going. I was listening to NPR, sitting in the driveway. They were talking about young people opting out because their prices are jumping so much, paying over $500 a month for healthcare. And then if young people drop out, the people that probably need it in a more preventative way, it just keeps the people who are dependent on it. And it starts this death spiral.
Absolutely. Right. We talked earlier about how important preventative healthcare is. And unfortunately, when you get rid of preventative healthcare being affordable and accessible, we're all just going downhill, because people are just going to show up with stage 4 cancers and heart attacks and strokes and raging diabetes, when we really could have prevented all of that. There's so many diseases in this country that are preventable. Don't get me wrong, genetics are a real thing. I'm not saying that's not true, but there are so many things we can do to prevent chronic disease in this country. And if we have no one with health insurance, so then they can't go get their free physical, because now that free physical costs them $12,000 a year, right? It's maddening to me. And so that's really why we try to keep our costs affordable, open to most people. Now I understand, so our memberships are $79 to $99 a month, right? Depending on your age. And so I realize there are people that $79 a month is a stretch, but for most people, they can probably find $79 a month. And I'm going to tell you, without your health, nothing else matters. So
that's so good. Well, thank you for your pioneering spirit and community heart. As we wrap, like David passed on a question to you, we'd love it if you would pass on a question to the next guest. Now, to set this up, you know him. And so it's a dear friend, Justin McCullough.
Oh,
so feel free to ask anything.
I want to know, how does Justin define success? That's what I want to know.
Okay. What we'll kick off the next episode with.
Don't let him watch this before this.
Not a chance.
We won't have time. Don't worry.
It's hard to catch off guard, but
I know.
we'll see what we can do.
You love Justin. He's an amazing human being, is a big reason why I am where I am today. So
that's awesome. Well, to wrap up, you said the website. How do we get connected to what you're doing? I legitimately am going to go sign up for a membership. So
come on over, my friend. Impact Family Wellness is the name of my clinic in Central Texas. If you are not in Texas, there are clinics like mine all across the country. They're not as good as us, but they can try. If you're a healthcare provider hating life and you want something new, the dpcformula.com is where you can find all of my book consulting and such info. But also, if you're trying to find anything about me, just Google my name. It's pretty uncommon, Monica McKitterick. I think I'm pretty much the only one. So reach out to me, LinkedIn, email, all the things. It's all over the place.
Awesome. Hey, last question. Does this look infected? No, I'm just kidding.